What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering how to be able to troubleshoot your X-ray tech equipment. So to give you context, I am a night shift X-ray tech. Been doing it for over 4 years now at a Trauma 3 ER in the great state of Texas. So essentially, there's some things that we as X-ray techs can troubleshoot really easy, and we do not have to involve the actual mechanics or the actual technicians, as they are referred. So some of the more common ones you will find is sometimes when you go to connect your portable to the outlet and you didn't shut it down, it can cause it to have a red light, or it can cause it to throw up a little code. Like ours at the bottom will throw up a little code. So most of the times, make sure you shut it off and then plug it in. But if you accidentally do that and your shitty equipment doesn't want to shoot or turn on anymore, the most simplest solution is, depending, like I have Fuji's. Usually on the Fuji's is the one that has that problems. The GE's and the Siemens usually don't. But if it does, all you have to do is disconnect it from the top power, turn it on, turn it off. If that still don't work, sometimes you have to kick the bumper to reset it. Worst case, you shut it down all the way and then you reboot it. Sometimes the system won't turn off, and somewhere, usually towards the bottom of it, there's a circuit breaker. For those who do not know what a circuit breaker is, it's essentially a little lever and you flip it on and off. That's it. And it will manually cut off the power off of the thing and you just reboot it. That's a simple one. Usually it happens more to students. Sometimes it happens to techs if we're really busy. Another issue you'll find is the network issue with the internet. Sometimes you can't fix it because the machine inside has some problems. Other times it's as simple of reconnect, refish it, like refresh the system or reboot it and it'll reconnect to the Wi-Fi. Other times you will literally just have to move a little bit around the hospital, like the little radiology area, and it'll reconnect to the internet and you'll be fine. Sometimes the network, like overnight, we have like updates or the network goes down. Sometimes you'll have to manually hardwire it. You grab like the ether cable and you like connect it to the actual X-ray machine, and there'll be a little internet like outlet. You'll just hook it up to the wall and then that will manually send it. You'll just have to push it manually in the system. That's something that occurs. Let me see. If the power goes out, if there's a storm or there's something, usually the generators kick in, but our system, since they are hooked up to the generators, since it did have a slight, like maybe, 3-5 seconds or 10 seconds of without power, and it kind of tripped onto the generator system. Sometimes you'll have to, once again, in the big X-ray rooms, find the levers of the little circuit breakers and manually turn that on. Because sometimes if you don't do that and you'll try to shoot an X-ray, because your computer will be on, it'll shoot blanks. So that means you will have to manually turn it on, the little circuit breaker. That one can be a little bit hard sometimes, depending on the equipment. That might take a little bit of muscle to re-flip that circuit breaker. That's something that happens. Other times, if the machine, if you try to shoot it, I'm talking about the big X-ray units here. If the machine isn't lined up properly, it won't shoot. Even if you flip the key, sometimes it still won't shoot. Sometimes it can be maybe a sensor. Sometimes maybe it can be because you don't have it aligned to the right. Like you're shooting someone on the table but you have it on the wall bucky. That's like a simple common, usually the students will have that. Or certain machines, if you angle the tube, it won't shoot. As I was saying, other times what will happen is, and this is on the portable machine, and I noticed it more on the GEs, as it's called. The box, there's like a box, like on the collimator. Sometimes it will shift off because like on the Fujis, they just have a solid metal box like to collimate, and it doesn't have like a little lens on it. Sometimes the lens will move on the GEs, which will cause you to shoot, and it will look like you collimated or part of it won't be exposed. So that's something that's a simple, like you just have to push the little thing. That does like a simple troubleshooting, stuff like that. With the GEs, I've noticed, and once again, you may be fortunate enough and you don't have to deal with it because your hospital has better equipment than mine. But if you're in a position where you have shitty equipment like ours, sometimes the boards, I notice on the GEs, when you have to go to shoot someone, you pull out the board from the charger, it will take like a 10-second to connect to it. Sometimes what we'll do is, from the first patient, you'll take it out, you'll let it connect, and then you won't put it back to the charging port in between patients, you'll just leave it out so you avoid that little reboot. Sometimes when you go to pull it out, it still won't connect, and you'll have to manually push. There's like a little power button on the board, the actual platelet board, the portable, and you'll have to hold it down for 30 seconds and it'll turn off. And then you wait like 10 seconds, 20 seconds, and then you click it again, and then it'll reboot connect. Other times you'll have to remove the little battery and put it back in. That will get the trick. Other times you may have to, it'll be a network problem. And on that one, I'm still not sure how the network works on that one. I don't mess with the GEs that much. I mainly use the Fujis, so I couldn't tell you how to fix that one problem on that one. But like on the Fujis, it's like essentially, it's like a computer, and you just click like you're on a basic any PC window, and you just try to connect to the network. It's nothing hard on that one. Sometimes you'll go and shoot the patient on the portable machine, and it will shoot blanks, right? So one or two things could have occurred. Either you didn't let it rotor fast enough, like you try to expose it too quick, or you didn't press the button like good enough, and essentially it'll shoot a blank. Most of the time you just add another one and you'll shoot it. Other times, because you shot it properly, you just shot it under the PD board instead of the big board. PD board is the tiny little baby one, and then the other one is the 14x17. So that will cause blanks. Once again, those are easy switch. And I noticed every once in a while, you'll be shooting normal, and then it will give you a code, like it won't shoot. Like it'll rotor, but then it won't shoot. It happens after every couple hundred exams. I don't know. I've done it so long, I've noticed that at least once or twice per shift that will happen. So that's something that happens with depending on the equipment you got. Let's see. That one, once again, you just add another exam and you just click it. Other times, if you go to shoot it and you didn't click the next exam, it won't expose. Some places you have to, like, he'll shoot it after the image was exposed automatically. Other times you have to add another exam on the little thing, the little icon, like another chest, and it'll shoot it. And you can continue on. Let's see. Sometimes images won't send across. It could be a network problem. It can be maybe you accidentally hit the X button on the portable. That's a simple, you just go back on the portable, undo it, and then send it again. Sometimes I've noticed that when you copy images on the portable machine, because sometimes you shoot like a tib-fib at ankle, instead of re-exposing the patient, you can just copy the image and then just like collimate it, Alara, for those who care, because most other people outside of our department don't. To save you from exposing the patient, you can do that. But then sometimes if you copy too many, depending on your equipment, it may lag and it may freeze. And when it freezes, I remember the first time that happened, it scared the shit out of me, because I was like, oh dang, you have to essentially reboot it completely. And I was scared that these images would be lost and I'd have to reshoot the patient, and like the patient, his stuff was like broken. So I knew if I had to come back, it would not be good, and maybe the patient wouldn't let me do it again. But thankfully, the portable machines have like a built-in system where it's either saved locally or it will send it off like it is, and you can still find it and you'll still be okay. Like I remember I rebooted it and the images were still there. So it's good. The only thing, if you copy images, you'll just have to crop out or move the little stamp out of the way. Let's see what else we can do. Sometimes the bulb will go out. Depending on the level of tech, like X-ray tech you are, sometimes you could switch out the bulb. Like some of our veteran X-ray techs, they know the system so well, or the actual technician has told them like, yo, this is where we keep our bulbs. It's literally, if you've ever switched a regular light bulb, there's like a little screw, you undo it and then you shove the little light. It's literally like a regular light bulb. It's just tiny. That one, it all depends. I personally haven't experienced it or done it, so I wouldn't touch that part. I would leave it to the professionals, more for liability. But we have certain techs that have been doing it for like 20 plus years. It's a simple thing like that. Off the top of my mind, that's all the main things we deal with. All the other stuff that I could think of to help you, it will rarely happen, or it happens with stuff that is just kind of, if it happens, maybe someone in your apartment, or it'll be more like very niche depending on the system you use or depending on the equipment. And I can't really, like, there's no point of me talking about it. You won't really be able to use that knowledge because maybe you won't have those equipment, or that stuff won't happen to you. But there's other stuff too. But anyways, it's been your boy Miguel. We'll see you on the next one.